Good afternoon, everybody. Welcome to the second in our webinar series, the second of three. Our first one was a month ago, and I will make sure everybody on this webinar gets a link to that recording as well as the current webinar when we complete. The first one was how to beat the competition, branding your practice in 3 easy steps. Today's webinar is how to identify which social media sites are right for you, and our January webinar, how to get more patients from your website. I am Dan Edwards, the CEO and President of Pact-One Solutions, and I'd like to welcome Lacey Phillips from Practice Dynamics, and thank you very much, Lacey, for putting on this webinar.
Thank you, Dan, for having me. I'm super excited. Shall we get started?
Yeah, let's get going.
Okay, we're going to jump right in. How to identify which social media sites are right for you. And how we want to identify this today is we're going to talk about your actual practice management software that you're currently using in your practice. No matter which software you are currently using, what we want to identify really, instead of just deciding, oh, we should use this social media site or we should use this one, my kids talk about this one, rather than just randomly deciding which social media sites we're going to use, we're going to dig a little deep. And I'll talk to you today about some key demographic information we can get from your software to find out. What those might look like is, number one, how many active patients do you currently have right now? And maybe we want to set a goal for retaining those patients and then gaining new patients. We really want to look at what type of dentistry you perform. We'll discuss this a little bit more because you might be surprised at what you're actually doing. What about your location right now? Where are you located? Where are your patients coming from? And then, of course, we'll look at the age and the gender of your current database to kind of decide which social media site you should have a presence on, because all of those factors play a key role in that. Now, if you joined us last month, we talked about 3 steps to branding yourself, basically, to finding out who you are. We talked about your mission statement and your vision statement to make sure that those are in line with who you really are, making sure that your team is on board and that they agree with your philosophy, and then branding was a huge part of last month. The branding is really, truly just figuring out who you are, but putting it out there. So remember, your branding is what your patients, your customers walk away with. When you're not in the room, what do they know about you? So we're going to I'm going to assume that you guys all went home and did your mission and your vision statements, and they're amazing, and you've discovered your brand. Now let's move on from there. Let's talk about the why. Why of social media first and foremost? Why is this the thing right now? Number one, it's recognition. It's how we get our recognition now. It's building relationships. Social media is all about relationships. Whether we're talking professionally or personally, what we do every single day of our lives now is build a relationship. And the biggest platform that we do that are on social media sites. This is also where our reputation comes from. Our reputation can be started and it can be finished on social media. So really what the why of social media comes down to in business today, it's how we market. The days of the phone book, the yellow pages, huge billboards, I mean, I still see some of the billboards, which is certainly fine, but the way we market now in today's world is through social media, which is kind of nice for us because it also gives us the opportunity to spend our money a little bit differently. Now, according to Sesame Communications, 48.8, so almost 50% of dentists in the United States say that having a social media presence is important to the success of their practice. I agree with this 100%, and to tell you honestly, I think that 48.8% is a little bit low. I think it's probably more like 78%. Now, I put this demographic on here because 78% of small businesses attract new customers. If you think about dentistry as a whole in our industry, we are a small business. For the majority of us in this industry, it's a small business. So 78% of us attract new customers or new patients through social media. Again, we're looking at the why. Why is this what we're doing now? Why is this such a big part of our conversations? And let's take a look at where the users are. Of course, you have your big ones out here. I'm going to go to Facebook first, even though they're number 2. Facebook, of course, with 1.23 billion users on there, right? So this is where the majority of everybody is. YouTube, we're going to talk a little bit about YouTube today. You know, I don't know if you know this, it's actually the second largest search engine in the world. We don't always think about that. YouTube is a search engine, but it is. And then next we have our Twitter users, 241 million Twitter users. And this is, remember, our active monthly users. And then we go to Instagram. LinkedIn, of course, over here is a little bit bigger. So those numbers are going to help us here in just a little bit figure out where we should all be on these social media sites, which ones, because there's a ton of them. There's so many social media sites, it becomes overwhelming and mind-boggling. How on earth, as a business, are we supposed to keep track of these? Honestly, in my opinion, I don't think there's any possible way for us to utilize all of the social media sites. And I think it would be redundant and ridiculous for us to do so. So before we jump into the sites, let's discuss the demographics of your office and why it would make sense to use specific, specific sites. One of the things we want to look at is we're going to pull some reports. So no matter which software you're using, if it's Dentrix, SoftDent, EagleSoft, Easy Dental, Open Dental, Curve, PracticeWorks, no matter what software you're currently using, we have the ability to run some reports to really get down to the nitty-gritty of your office. First and foremost, what type of dentistry do you perform? Are you an orthodontist? Are you a pedodontist? Are you an oral surgeon? Are you a cosmetic dentist? If you're a general dentist, where is your focus? Now, a lot of times I have dentists who will tell me, oh, I am, as a matter of fact, this is a true story. I had a dentist in Louisiana tell me, I am a CEREC dentist. Man, I have trained on it. I love my CEREC. I'm a CEREC crown dentist. And that's what I really want to focus on. And we said, fantastic. We ran some reports. We pulled her numbers. And guess what? She was not a CEREC dentist. She was actually a four-surface composite molar filling dentist. So after running that number, we were able to see that the majority of the procedures she did in one given year was composite four-surface fillings, not CEREC crowns. At that point, you need to sit down and you've got to decide, okay, is this because that's the only thing I'm presenting to my patients, or is it because that's what they're accepting? Are you presenting them options, but they want to go in a certain direction? And then where do we want to market that to? Do we want to continue to market to that, or are we going to go in a different direction and really market CEREC crowns? This piece of information helps us with our post. This will help us decide what we should be posting, how we should be advertising, what products, what procedures we're going to talk about on social media. So you want to run a report. And like I said, no matter what software you're using, you have the ability to run a report to say how many procedures did I do last year, what is the percentage that it makes up my practice, what did I produce, and what did I collect off of those certain procedures. Okay, hopefully you know how to run that report right now. It's in an analysis report. If not, feel free to reach out to us. We can help you with that. The next one I want to know is how many active patients do you have? Now, the word active alone brings on a huge conversation because there's active based on what our software tells us we have. For example, you can have active patients, inactive patients, and archived patients. That's literally an option. It's a button that you push. What I'm talking about is an active patient. Now, how we decide what an active patient is, any patient who's current. A patient who is currently either in your hygiene department and who's being seen on a regular basis, or who is current with your restorative treatment that you have diagnosed. Sometimes when I ask team members or doctors, what do you consider an active patient? I get anywhere from, if they've been in the last 18 months or if they've been in currently. Again, what we consider to be an active patient is a patient who is current in whatever treatment you have diagnosed for them. So we want to run that report. How many patients are actually current? This gives us a good idea of your true active database. Do we want to retain just that, or what percentage would we like to increase your patient base? The next thing we want to look at, age groups. Again, are you a pedodontist? Are you an orthodontist? Are you situated somewhere maybe in the Sun City area, so you're looking at an older group of patients? What are your age groups so that we can, again, identify what type of dentistry you're doing, what social media sites we're going to be on, and how exactly do we advertise to those patients. So this is, again, going to be in a statistics list within your software. Gender. I always find this a little bit interesting. I've got some infographics for you a little bit later on gender, who is on social media sites, but I'm always curious to see, do we have more female patients, a lot more male patients, or are we right there in the middle with the two of them? And again, it's all about advertising. How do we reach out to these? Now, one thing we will discuss a little bit later is, where are your patients coming from? You may think just because you're located in one particular zip code that you're receiving all of your patients from that zip code as well. We want you to run a report. What are the top 3 to 5 zip codes where you're getting the most patients from? What does that demographic area look like? What does that geographical area look like? What is the median income there? Are there a lot of schools in that area? Is it more of a corporate area where you're getting your patients from? So we want to take those, I think there was 5 reports, okay? Now we want to take those 5 reports and really break down the foundation of your practice and who it's made up of, so that then we can make some really wise decisions where your presence on the internet should be. Once we discover who your patients are and where they're coming from, then we get to jump into this fun world of, who do you tell? Who are you going to tell, and how are you going to tell them? So in dentistry, I feel like there's about 5 social media sites that everybody in dentistry should be a part of. Obviously, my number 1 is going to be Facebook, because that's where everybody is, right? Twitter. I think that you should have a YouTube account. Depending on the age demographic that you're seeing, I think you need to be on Instagram if you have anything younger than 21 years of age that is a majority in your practice. And then the LinkedIn, I threw it in there because LinkedIn is that professional networking account. And I think we have to still remain professional with our networking. It enables us to create groups or belong to a group, a professional group. For example, if you're an oral surgeon, then you can join the oral surgeon group there on LinkedIn and do a lot of networking that way as well. LinkedIn is also a great place for your team to professionally network with with their peers and get more information as well. So this is where we're going to concentrate today, and I'll explain why. Facebook, like we saw before, 241 billion monthly users on Facebook. We don't have a ton of the kid graphic on Facebook anymore. Believe me, that's where they started, but they all left because now as adults are on Facebook, so they left. But we still have some kid action, not a lot. This is really where you're going to hit a certain age demographic on Facebook. But you know, one of the easier ways to see this is to go on Facebook now if you have a personal account and take a look at your friends and who's on there. But again, I think everybody in dentistry should have a professional Facebook account. And again, make sure it's professional. The easiest way to build your professional account, doctor, owner of the practice, you should have a personal account, and then you build the professional. They're not necessarily the same, they're not the same thing at all, but you need to own the professional page. I can't stress that enough. The doctor, the owner of the business, needs to own the professional page. I'll tell you why. We've had several doctors contact us and say, I had a team member or an office manager that built the page, they were administrator, they were owner, they left the practice, and now they're holding my Facebook page hostage. So whoever owns the practice, the doctor, you should be the owner of this page as well. You can certainly ask a team member, as a matter of fact, we recommend that you have a team member, an actual person in your office that is your administrator. We even like to have a social media and marketing director per se, and this is a team member. For us, it's a team member, somebody who's inside your practice, somebody who knows your patients, somebody who knows your team, who knows you, knows what kind of dentistry you're providing to your patients. This is your marketing director. So they can certainly be the administrator of this page. They're going to be posting for you, getting the ideas for you. The doctor owner is the actual owner of the professional Facebook page. Next is Twitter. I'm going to be real honest. I have a hard time with Twitter. I think it's maybe that 140 characters because I hardly do anything at all in 140 characters. I would much rather have a more lengthy conversation. But the numbers don't lie. Again, you're looking at, I think, I don't remember that number exactly, but I think they were number 3 on the player list as far as how many users are here. Now, I will tell you, the younger generation is all about Twitter. They are tweeting out the post every day, multiple times a day. So I do think you need to have a place on Twitter. It's maybe not going to be as large of a presence as you have on Facebook, but you've got to be on there. In discussing all of these websites or all of these social media sites, I personally am not a fan of posting the exact same thing on 3 to 4 different sites. For me, if I'm following you, I don't want to see the exact same thing 4 different times. I'll only follow you on one site. What we want to see is a little bit of variety here. And I have a great tool that can actually help you manage not only the sites that you're using, but your content that you're putting out there as well. So Twitter is number 2 for me. And then we have to have YouTube. We have to have a YouTube page. Again, it's the second largest search engine in the world. And we don't think of YouTube as a search engine like Google is, but if you think about how do I do this? How do I do that? What does this look like? I go to YouTube. I go to YouTube and look it up. So for me, a YouTube channel for a dentist office is very professional. I always recommend that you have a professional video tour of your office. So walking through the front door, greeting your business team, taking a look around the reception area, and then walking through the clinical area as well. Take a look at the operatories. What kind of technology do you have here? What are your OSHA standards? What are your HIPAA standards in this office? Is there a private consultation room for financial information that's being given out? And so another video I like to see is the Meet the Team. I promise you that new patients are stalking you before they ever walk into your practice. They've already gone to your website and looked at pictures to meet the team. Now they're going to search for videos to tell them more about you. Other videos can be, what type of dentistry do you provide? Again, is it that CERAC dentistry? Is it implant dentistry? Is it orthodontia? So what kind of dentistry are you providing, and you have a review on that? Of course, one of our favorite videos is video testimonials from your current patients. It's a great way to get reviews out there, and you don't want them longer than 30 seconds, but you need to have them very well done. Now, I'm not saying you necessarily have to hire a videographer and bring them into your practice. Now, with today's cell phones, smartphones, and tablets, we can do some pretty good videos. Don't just take the first take. Take several takes, check your lighting, have a script, definitely have a script. And so you're going to make these videos as professional as you possibly can. So they're on your YouTube channel. Every now and then you want to post them on your Facebook channel, and maybe the tour of the office is also on your website. So a lot of your information and your content is in fact going to be shared, but not necessarily on the exact same day at the same time. Hopefully that makes sense to you guys. Let's look at the ecosystem that is YouTube. So right there, second largest search engine in the world. I find a couple of these so interesting. This just tells you there's a ton of video out there. More content is uploaded in 60 days than all three major U.S. networks, ABC, NBC, CBS, in the last 60 years. That's a lot of video content. 1 billion daily views come from people on a mobile device looking at YouTube. Hundreds of millions of YouTube is now being assessed from different devices, and more than 1 billion unique user visits YouTube each month. So it's a huge, huge site. I think that we have to be a part of this, and you want to make your videos really as professional as you possibly can. Instagram. If you have a large demographic in your practice that is 25 years or younger, you should be on Instagram. This is where the kids are. What I have in front of you right now, this is Hudgens Orthodontics. They get it. They know what they're doing when it comes to their social media. They've done such a great job. So they always post a picture. That's doctor with the sweater and the glasses on. They always post a picture with the doctor, with the kid when they first get their braces on, and then always on the day they get the braces off. And you'll notice in all the pictures, kids are always smiling. Now, what's fun about this, they tag the kids with their hashtag, right? They're tagging the kids, and then all of these kids' friends who follow them on Instagram see this. That's amazing instant marketing for Dr. Hudgens. I'm sure right now you guys are all thinking to me, and if you could raise your hand and talk to me right now, you would say, is this HIPAA compliant? Can they do this? You have to have a social media release form. It needs to be, I have a legal one and I have a generic one, but you have to have a social media release form that you want parents to sign and you want kids to sign. You absolutely need to have this documentation in your office electronically in the patient's electronic chart so that you have that covered. Because no, typically it's not going to be HIPAA compliant for you to be posting pictures of your patients. This is completely compliant because they have their release forms in order. What I like about this too is what they've done is they have several different campaigns that involve these kids. For example, they do different collage posters of all of these kids, and then that's their artwork in their office. So clinically, rather than having pictures of, nice professional pictures or artwork, they've taken these pictures, created a collage with them, and then have posters made of them, and these are hanging throughout the office. Again, instant great marketing. I love what they've done. I follow them on all of the sites. And then I tell them, of course, I talk about them in my course. So just, you got to follow, you kind of got to look at your peers and who's doing it really well and then who's not doing it so well. Instagram is like YouTube. I mean, the kids are there. They have 100 million active users per month. 40 million photos per day. If you're not familiar with Instagram, it's all about pictures. It's not just text. You have to post a picture with Instagram. And then I like this one, 1,000 comments per second. So they're commenting on it. You'll see your age demographic here. So the biggest, let's take these three demographics. You've got 12 to 34. 12 to 34-year-olds is your largest demographic on Instagram right now. And of course, there are more women. You've got more females on Instagram than males, not by a ton, just about 10% more females on there than men. But what we're really looking at here is this age demographic. That's where your young ones are, is there. Just a quick one for you here, Insta Collage. Remember I told you that ortho office, they create those collages. This is a really nice free app that you can have on your smartphone or your smart device to create those collages. And then that one is an Apple, the Android device is Pixlr. It's Pixlr. Pixlr is the free Android device. Pinterest. I love Pinterest, but I'm a woman. What can I say? If there's anybody here on the webinar today that's like, what is Pinterest? It's a really cool electronic pin board. So you take ideas and you pin them, and whatever you pin and it's public, all of your followers can see this. Why? Is that what you're saying right now? Let me tell you about Pinterest. Number one, it's women. 80% of the users on Pinterest are female. And men might be saying right now, well, then why do I care? Let's think about this in a dental practice for just a minute. Who are the majority of your patients that bring family members to your appointments? Women. If you have to reschedule appointments or talk money, who are you going to call? The women. So we find that moms and females make up the majority of our dental offices or the conversations that we have to have, so we want to reach out to them socially as well. Pinterest is just fun. Now, I'm going to tell you, as a dental office, this is not where all of your dental content is posted. You should be doing fun things on Pinterest to grab their attention. For example, here's some of the most popular pins on Pinterest. Food and drink is the biggest with almost 30%. We do recipes on there. We have, like right now for Thanksgiving and Christmas, you could be posting really nice Christmas dinner ideas, okay? The next one, the next biggest demographic here is your do-it-yourself and your crafts. Christmas trees, Christmas ornaments, how to make a mistletoe ball. And you don't have to go searching for these anywhere but on Pinterest. They're there. You repin them. Moms love it. Women love it. I think it's an important thing for us to do. I certainly don't think you have to spend a ton of time on Pinterest, but I do think you need to have an account and have a small presence there. So where is your target audience? Hopefully you're kind of beginning to understand where I'm going with this. It's not a matter of just saying, okay, everybody's on social media, so we will be too. We are really going to own in on this and figure out where exactly do we need to be. Demographic-wise, we're looking at, these are the ages up here. Okay, and where are they? The largest percentage here is 25 to 34-year-olds. I personally think this is a little old because I think it's probably more 35 to 54-year-olds are on Facebook now. YouTube, you've got a pretty good variety on YouTube. This says 16 to 24-year-olds. Again, I need to find, it's so hard to find current demographics. They go at least 12 months out. Google+, Twitter, of course, you've got the larger demographic here. LinkedIn is our professional account. Instagram, definitely. You know, again, your two biggest are 16 to 34 years old. Whoops, I'm going to go back, so sorry. Pinterest, not as much of the older demographic. MySpace. Oh my gosh, is anybody out there still on MySpace? That's crazy. That scares me a little bit that it's in our demographics. And then gender-wise, if you look at these, YouTube is pretty equal. LinkedIn is pretty equal. And then Dig and Reddit are the only two media sites out of 9, right, that men have a larger presence. What I find funny about that is Dig and Reddit are both like online, almost newspapers. You get to customize the content that you want to see every day. It's not really a social site. It's a news gathering site. The rest of them, you're looking at, the women are probably on social media a little bit more than the men are. So remember last month, and I want you to, as you move forward with this project, always remember at the center of all of this is always going to be your brand. And you're going to use your website with your brand and take it to Facebook, take it to YouTube, take it to your Twitter account. Make sure that your brand is always at the center of this so they always know who you are. For example, one of my favorites, of course, anybody who's met me once know one of my favorites is Starbucks. This is their website. Okay, so obviously great branding. Really for us, all we have to see is their logo to know exactly who they are. But when we take a look, if you take a look and you go on to their social media sites, you know it's still them. One little thing, talking about websites, make sure that all of your email addresses, and oh, by the way, every single person on your team should have an email address. Make sure that they're professional and they are based off of your website. For example, this is our website address, practicedynamics.net. My professional email account is lacy.phillips@practicedynamics.net. It makes me cuckoo for Cocoa Puffs when we have a professional website and then your email is Dr. Tooth, Dr. Sensitive, Dr. Care at Yahoo. you need to make sure that your professional email address is based off of your website. And again, every single team member you have should have a professional email address. They should be printed on cards. Everybody should have a business card with their email address on there. And this is a great way for suppliers, for vendors, for our partners, and for our patients to be able to communicate with us. So back to social media. Okay, we're back to Starbucks. We saw their website, right? It was branded great. Now as we move into their Facebook page, it's all about the coffee as well. So they're continuing that branding on. You want to make sure no matter what site you're on, if you have a presence on 5 different sites, it's always based off of your branding. Now I will tell you, we have a monthly campaign at Practice Dynamics. And so our website remains static. It's our branding, but our Facebook page goes into a campaign. Just for an example, the month October is Breast Cancer Awareness Month. That's very close to both Bonnie and I. So we do pink. It's all about pink as far as our cover photo here and our profile photo. It's still about Practice Dynamics, but we've got a campaign. The month of November, giving thanks. What are we thankful for? December is, for us, it's actually not about Christmas, believe it or not. The month of December for us is finishing our year strong, making sure that we accomplished our goals, and being prepared for the brand new year. If you haven't set your goals yet, you're behind for 2016, right? So for us, our campaign for December is finishing strong, starting prepared. So you want to have your campaign, but make sure that it brings in your branding as well. I love this. We have become a society that does not read. We don't read anymore. Photo, anything with a photo in it gets 104% more comments and 84% more clicks than if you just have a text post. Videos and photos. People will actually click on the photo, they'll review it, they'll comment on it, and videos. I challenge you, I'll tell you this right now. When you're done with the webinar, if you're not going back to work, or tonight when you get home in your personal time, go onto your Facebook newsfeed and count in the first 15 posts how many of them have a video attached to it. And then start noticing yourself, how many times did you click on a video? We're doing it all the time now. Like I said, we don't read anymore. We just look at pictures. You know, selfies kind of started to get popular, and then they weren't popular, and then all of a sudden this is the selfie that took over the world, right? And now selfies are awesome. Everybody takes them. We even have a selfie stick to make sure that our selfies are the appropriate distance, and and that we can get as many people in there as we want, right? It just cracks me up. The selfie that changed the world. Twitter. Now, again, having that presence, 140 characters. These are quick little jabs, but of course now you can attach photos, videos, or you can attach an article so they can click on it and go somewhere else with that as well. Got to have that presence on Twitter, I think. Obviously, you don't have to be posting 15 times a day. As a matter of fact, we're finding if you post too many times, you lose your audience. There's this perfect little set of posts. You don't want to only post, you know, once a week. But if you post more than 6 times a day, and I would probably even say 5 times a day, people start to get annoyed with you and they might unfollow you. And YouTube, we discussed YouTube quite a bit before. Just make sure that your videos, that you do have content on there that people can hear the content, so a microphone is attached. And blogging. hopefully you guys out there are blogging. Blogging is a great way to get your audience and to get your reputation out there as well. Why are we blogging now? Number one, it's an online diary. It's chronological. You're putting it out there. It's more than 140 characters, obviously. They're short, sometimes between 200 to 350 words you're using. This is a big part of online brand advertising at this point, because the more you blog, the more you post, it actually raises your organic search engine optimization, or SEO. And it could also be an instructional resource. So this could be a place for patients, colleagues, peers to get information as well, depending on how clinical your blogs can be. So I told you I'd give you a little information about how to manage all this, because we talked about 5 different sites and it gets a little overwhelming. I know a lot of dentist owners come to us and say it's overwhelming and I really don't want to pay one whole other person to do all this, but I don't know how to make this happen. For us personally, I love Hootsuite. Hootsuite, exactly, social media dashboard. It allows you to, the free account allows you 3 to 5 social media sites, and it allows you to monitor them and post from one specific dashboard, which is, for me, a really great option. I can just bring up my dashboard each morning, take a look at where I'm at. If you'll look up here in the top left-hand corner, I have my Facebook account, Practice Dynamics Twitter, MailChimp, where our newsletters go out of, and then, of course, LinkedIn. Another thing I like about Hootsuite, on Google Chrome, you can add an extension. It's called the Hootlet, so Hootlet, and it's an extension that attaches itself to your Chrome. And so, for example, if I'm reading a great article on marketing from Mashable.com and I want to share that article, I simply click on my little Hootlet, and then it allows me to share that with my Facebook, Twitter, or LinkedIn audiences. What I also like about Hootsuite is you can post right then, or you can schedule your posts to go out certain days and certain times. So again, this is a free app. It's a great management software that allows me to take care of my social media sites in one place. So that's a really great resource to have. Here's the little Hootlet like I was talking about. So I'm reading an article. I want to be able to post this article and share. I can send it right now, or I can auto schedule it to go out at a later time and date to my audience. Quickly, I want to tell you, you've got to pay attention to your webutation. You have to pay attention to what others are saying about you. If you don't think others are sharing, you're crazy. 88% of consumers trust online reviews as much as a personal recommendation. That's huge. They're reading the reviews. Let me just ask you this. If you go on and you're looking at the reviews and all of them are 5-star, do you believe it? I don't. I don't believe them. I want them to be real. But everything I do, if I'm buying something on Amazon, if I'm looking at a restaurant, a hotel, airlines, I always read the reviews. And I take into consideration, sometimes they're just people who woke up to be in a bad mood, but the majority of them are true. So what's going to build your webutation? Blog post, the review sites, reviews on your sites, if you're involved in different forums, if you have press releases, and then, of course, social media. All of these things are going to factor in on your webutation. So you've got to be paying attention to that as well. Where you should be looking: Yelp, Yahoo, Google, City Search, Bing, Health Grades. Myself personally, I have issues with Yelp. A lot of people in the medical industry, dental industry do, because you have to pay them, which I don't agree with. That's a whole nother webinar, is Yelp alone, but you still need to log in, review to see if you do have any reviews on there and to see what they say about you. Okay. Patients are 10 times more likely to find you online than in the yellow pages. I promise you, they're bringing up their devices, their smart devices, their computers to search for you. I don't even have a phone book in my house anymore. I think maybe my parents do, but you know, they're 75. So, but they also search online now as well. 90% of those searching click on the first 3 Google reviews under the paid advertisements, not the paid ones, but the first 3 underneath that. So again, I recommend to all of you, when you're done with the webinar, go Google yourself. See where you come up and what comes up first. Does your website come up first? Does your Facebook page come up first? Does your Twitter page? Does your LinkedIn page? Whatever comes up first, this tells you where you have the greatest presence. That's your natural search engine optimization, or SEO. I know I'm throwing a lot of information at you in a small amount of time, but again, remember these things. When you're out there in the social media, all of these things dictate your reputation. Customer support, they will go talk about you. Are you out in the community doing community events, taking pictures, posting them that you're a part of this community? Do you have products on your social sites? I absolutely recommend that you do. Are you posting news? Did you guys go to CE courses and you're educating yourself to make sure that you can provide better health care? Are you posting that information? Who are you networking with? Your peers, your competitors, local restaurants, the favorite place that you guys get your lunch from. Where are you having your holiday party? Are you networking with them? Remember to always build your brand, get customer feedback, and you're trying to get that interaction. Always trying to get the interaction. So make sure that you're diverse. Make sure that you have the diversity of patients, of your patient base involved in your social media, and you're looking out for them as well. Remember, who are your patients? Are you seeing children? Are you looking for couples? Are you in a more elderly geriatric community? Are you working with teenagers for ortho? No matter what, remember Mom's rule, okay? Keep them in mind with everything that you're doing. Because moms are out there, 18.3 million searches. The moms are out there. And yes, social media can absolutely help you with your career. It can help you get new patients. It can help you with retention. It can help you with your education process and building that brand, right? So first step, who are you? Mission, vision, statement, building your brand. That was our first step from last month. You want to gain your recognition. You're building your relationships. You're paying attention to your webutation, right? You're building your great webutation. It's all about the marketing. This is how we're doing it now. And then you've got to decide who are you going to tell and how are you going to tell them. Top 5, Facebook, Twitter, YouTube, Pinterest, Instagram, and professionally, I think you should be on LinkedIn as well. Thank you so much for your time, you guys. I hope you have a fantastic holiday season. Be safe, be warm out there, and if you need any help with any of this, please feel free to reach out to Dan and his team at Pact-One or call us at Practice Dynamics. Have a great holiday. Dan, I'll let you take it over from here.
Yeah, thank you so much, Lacey. It was great information. Again, I wanted to remind everybody that this is the second in a 3-part series. The next series will be about how to get more patients out of your website. And the first, in the link of the email you get, within a couple of days, it will have the recording to this webinar. You will also get a link to the recording of the first webinar if you missed that one. Again, thank you so much, Lacey, and thank you everybody for attending. Have a great day.